Depression versus Dementia, Differential Diagnosis, and Management of Cognitive Impairment in Elderly Patients. The differential diagnosis of cognitive impairment associated with depression and dementia in elderly patients is a complex yet critically important task for selecting the appropriate management strategy. PET imaging with 18F FDG improves diagnostic accuracy by helping identify the characteristic regional hypometabolic patterns of neurodegenerative diseases, such as temporoparietal hypometabolism in Alzheimer's disease or occipital hypometabolism in Lewy body dementia, which are not seen in depression. However, depression itself can produce metabolic changes on FDG-PET. So findings must be interpreted within the full clinical context. Depression frequently coexists with cognitive disorders and is associated with an increased risk of dementia. The combination of both conditions carries a higher risk than either alone, although evidence for a synergistic effect remains inconsistent. Late-life depression is associated with higher rates of MCI and dementia, and its presence in MCI patients may accelerate progression, though the relationship is bidirectional. Depression can both precede cognitive decline as a risk factor and emerge as a consequence of early neurodegeneration. Some evidence suggests that cognitive profiles in older patients with depression may appear similar regardless of Alzheimer's biomarker status, though this remains an area of active investigation. This underscores the importance of ruling out comorbid Alzheimer's disease before attributing cognitive impairment to depression alone. Screening tools such as the 4-item Geriatric Depression Scale can help distinguish depression-related decline from subjective complaints, enabling early treatment and avoiding unnecessary specialist referrals. Treatment of depression in the context of dementia follows a stepwise approach. Psychosocial interventions first, followed by pharmacotherapy, typically SSRIs or SNRIs when needed, and electroconvulsive therapy, ECT, in refractory cases.